May is National Brain Cancer Awareness Month, and Dr. Douglas Rivera is a board-certified radiation oncologist. He's from Austin CyberKnife, and he's here today with more. Good morning to you, Dr. Rivera.
Good morning.
I'm glad you're here, and I'm glad you're raising awareness. Can you tell us about benign and malignant brain tumors? What are they? What's the difference?
Right, so first of all, brain tumors account for roughly about 80% of tumors that are going to be diagnosed in the brain this year, roughly. Benign brain tumors are something that basically grows and doesn't invade the kind of surrounding tissue, although they can be deadly if they grow in a bad place and grow very large. Cancerous tumors tend to be ones that kind of invade into the adjacent structures.
Oh, okay, all right. I didn't actually know the difference between those two things, but the benign one is the easier to treat of the two, right?
In general, location makes a difference, but yeah, usually the prognosis is much better and they're much slower growing.
Mm-hmm. So this is important to know the difference between the two. Mm-hmm. So what are some signs or symptoms of brain tumors, either benign or malignant?
So brain tumors are difficult to diagnose sometimes, primarily because it really depends on where they're occurring and the type of tumor that occurs, cancers versus benign, and where they are. So the symptoms can be varied. It can be simple as headaches, could be just lethargy, but it could also be stroke-like symptoms, could be vision changes, facial numbness, lots of different things like that. So really, if things don't feel right, you have to go to a physician about those things, and they can probably diagnose it.
That's good to know, because I think so many people think, it's just a headache again today or something like that. They may not take it as seriously maybe as they need to be taking it. Is that right?
Yeah, in general, headaches for the most part are not going to be serious, but things that are generally progressive or get worse over time, or really new onset for an individual, should be considered more serious.
Okay, all right, so make an appointment with your doctor for sure. So I want to ask you, Dr. Rivera, we've heard a little bit about Austin CyberKnife before. It's an incredible process, everything that I hear from y'all, but tell me specifically, how does Austin CyberKnife treat brain tumors?
So it's a radiation tool. It's the only one in Central Texas that we have, but it's one that delivers really focused and accurate radiotherapy to tumors, not only in the brain and the spine area, but also we can use it for things outside of the body, or the rest of the body as well.
Well, that's incredible. And I know that, for example, patient recovery time, things like that are drastically improved by using something like this. So I'd like to hear from you as well, the benefits, if people are looking at, what are my options? What are the benefits of using CyberKnife?
Right, so it's a non-invasive approach, doesn't require anesthesia. People kind of walk in, they get their treatment, and they can drive themselves home.
Wow.
So in that regard, it's a very nice alternative to surgery. Sometimes we'll use it instead of, but oftentimes we can also use it in combination. It just depends. We do work with our neurosurgical team to not only evaluate patients, but to treat them with the most effective modality that may work for them. So again, kind of looking back at it, what it does for folks is it's really kind of a non-invasive alternative of treating these malignant or benign tumors.
I know that cancer treatment can seem scary, so anything that's going to help with that is something to look into. And just real quickly here, with Brain Cancer Awareness Month coming, is there anything specifically you want people at home to know? Just because this is the month where we're trying to say, hey, you should actually look at this. This is something that affects people.
Yeah, I think there's lots of attention for lots of different types of tumors are out there. This is definitely one also that we don't really think about as much, but it does affect lots of different people. Certainly there's, John McCain had a brain tumor, and that was, so it's real. It happens to everyone. It doesn't matter who it is, and I think people sometimes think it can't happen to them, but it really doesn't care. The demographics are widespread on who it can occur with.
Okay, all right, very important information to know. Dr. Rivera, we appreciate it so much. Thank you.
Thank you.
Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. Call them 512-324-8060 or go to austincyberknife.com for more details.